Time is the one thing we all have in common, but it's also the one thing we use differently. Good day everyone, we are the Group 6 and today we are going to dive deeper to understand the concept of time and how it varies according to different cultures. In mathematics, time is a continuous and ongoing series of events that happen one after the other, from the past to the present and beyond. The duration of events or the time between them can be measured, quantified, or compared using time, or events can be sequenced using this method. However, cultures interpret time differently, affecting their approach to healthcare. So, nurses should evaluate patients' cultural backgrounds, including how they perceive time, and the necessity of modifying their care plans according to each patient's cultural background in order to improve health outcomes. Because if there is a misunderstanding regarding time, it can create barriers between nurses and patients. For example, a nurse expecting a patient to arrive at a specific time may not consider that the patient comes from a culture where being late is acceptable or unimportant. So this can lead to frustration on both sides. So in conclusion, understanding a patient's perception of time can enhance compliance with treatment plans. Nurses who are aware of cultural differences can tailor their approaches to scheduling appointments or discussing medication regimens in ways that align with the patient's temporal perspective.
Transcultural nursing recognizes that perceptions of time vary significantly across cultures, impacting healthcare delivery. Nurses must be flexible with schedules to accommodate these differences, enhancing communication and patient trust. This adaptability is essential for effective care, allowing nurses to respect cultural values and improve patient outcomes. We have four types. We have the relative phenomenon, broader frame or reference, traditional times, and the importance of the present. So first we have the relative phenomenon. In certain cultures, time is seen as a relative phenomenon, meaning that individuals may prioritize the overall flow of events rather than specific hours or minutes. This perspective allows for a more flexible approach to scheduling and daily activities where the emphasis is placed on the relationships and experiences rather than strict adherence to time. Next is the broader frame or reference. Some cultures adopt a broader frame or reference for time, distinguishing primarily between day and night rather than focusing on specific hours. This perspective emphasizes the natural rhythms of life and activities associated with different times of day, allowing for a more flexible approach to daily routines. Third is the traditional times. Many cultures have established traditional times for meals, sleep, and daily activities that reflect their values and lifestyles. These routines can greatly impact health and well-being, as a consistent meal times contribute to better sleep quality by regulating circadian rhythms. For example, some cultures have later dinner times while others eat earlier, which can influence family dynamics and social interactions. Fourth is the importance of the present. In some cultures, the present is regarded as the most significant aspect of time, with a focus on living in the moment rather than adhering to strict schedules or future planning. This perspective often leads to a more flexible approach to daily activities and relationships, emphasizing experiences and interactions over punctuality.
In society and culture, time is a crucial component. Robert Levine, a psychologist, examined how various cultures view time. He discovered that nations with more developed economies, such as the United States, Germany, and Japan, progress quickly. That is to say, they greatly valued time since time is money. On the other hand, slow-paced nations are those with underdeveloped economies, like Eastern European, Latin American, and Middle Eastern cultures, all foster a more laid-back view of time. They are more focused on their social and familial lives. So, psychologist Robert Levine studied how different cultures perceive and use time, showing that economic and social factors shape each society's pace of life. In economically developed countries like the US, Germany, and Japan, people have a fast-paced lifestyle. They see time as limited, valuing efficiency and productivity. This leads to strict schedules and focus on career advancement, where time management and punctuality are highly valued. In less economically developed regions, such as parts of Eastern Europe, Latin America, and the Middle East, time is viewed more flexibly. Here, people emphasize personal relationships, family, and community. Social gatherings are more relaxed and spending time with loved ones is prioritized over rigid schedules. Levine's research highlights how these differences in time perception reflect each culture's values and economic realities. His findings remind us that each society has its own unique approach to time, influencing everyday life, social interactions, and even mental health. So, sa US, ingon sila nga, for example, time is money daw. Ug madali jud tanan, kung malit ka og 5 ka minuto, nagtanaw na sila sa ilang relo. Pero diri sa Pilipinas, kay Filipino time, means magsugod ra kung magsugod, kung ang party kay ang sabot, diba, 7. Nya, ayaw nagka-surprise, ug ang imuang mga kauban or imuang mga kasabot kay moabot og 8 or 8:30 or 9. Ang oras dire, mas importante man ko daw kuno ang bonding o pag-enjoy sa moment kaysa magdali-dali. Si Levine siguro mag-ingon, pareho tag planeta pero lahi-lahi ta og oras.
E se io muoio da partigiano, oh bella ciao, bella ciao, bella ciao, ciao, ciao.
Okay, so now let's talk about the future-oriented cultures. So first is European American. It is a culture that values business, which equates a hectic and frenzied lifestyle with success, status, and importance. So in European American culture, time is often viewed as a linear and measurable resource closely tied to productivity and efficiency. So kini na perspective nila, gina-emphasize nila ang punctuality, schedules, and deadlines, with time frequently equated to money and something that can be spent or saved. So this approach drives a structured, goal-oriented mindset where managing time well is linked to personal responsibility nimo as a person, personal success, respect for others' time, and as well as professionalism. So ang mga European o American culture po ay gina-consider nila ang time as a future-oriented because they often focusing on planning for the future achievements or setting goals to work. So as a result, ang mga European American culture tends to prioritize time management tools like kanang calendars, clocks, reminders, or magbuot sila og daily plan nila to keep things orderly and predictable. So, in contrast, napoy uban na culture nga ginaview nila ang time in a more relaxed or natural way. So, seeing it as a cycle that follows the rhythms of life rather than strict schedules. So, instead of focusing on precise hours or minutes, people in these cultures might see time in terms of events or seasons, like the time of planting, harvesting, or kanang family gathering. So, kini na approach nila, mas gina-value nila ang being present in the moment rather than always planning for the future. Like, gina-allow lang bitaw nila ang time to flow more freely. Kanang mas gi-cherish nila ang moment karon, wala nila gina-stress ilang kaugalingon o plano kung sa may tabo in the future kay ibi na natumatag na ang ginuoray na kibaw. So ang ilang gikuan ilang gipahalagahan ang karon na moment manay lang ginabuhat.
目を閉じて思い出す過ぎ去りしあの子
Japan is an extremely time-conscious culture, although the Japanese probably lay more emphasis on time management and efficient lifestyles than Americans, and consequently may feel less constantly rushed and frustrated. In Japan, the concept of time is often viewed through a lens of precision and punctuality. Time is highly valued in Japanese culture, and this is reflected in various aspects of daily life, including work, public transportation, and social interaction. Like first, their punctuality. Being on time is considered a sign of respect. Trains and buses are known for their punctuality, and arriving late is generally frowned upon. Second, their work ethic. Many Japanese people dedicate a significant amount of time to their work. The work culture can be intense, with long hours being common. However, there is also a growing movement toward work and life balance. Third, leisure and recreation. In their free time, people in Japan engaged in various activities like traditional practices like tea ceremonies, calligraphy, and martial arts coexist with modern pastimes such as video gaming, anime, and attending festivals. And lastly, their seasonal awareness. The Japanese have a deep appreciation for the changing seasons, which influences their activities, festivals, and even culinary choices throughout the year.
India's concept of time is often shaped by a deep cultural orientation toward the past and the present, making it more relaxed and less strictly structured compared to many Western or East Asian societies. Rooted in centuries-old traditions and a cyclical view of time from Hindu and Buddhist philosophies, Indian culture generally places a greater focus on the continuity of relationship and events rather than on strict punctuality. Unlike in Japan, where punctuality is culturally essential, India's approach is more flexible. This can be seen in common situations like train schedules, where delays of several hours or even a day are not unusual and typically don't cause significant stress. Time here is not viewed as something to be rushed, and there's a certain acceptance that things will happen as they are meant to in their own time. This past-oriented culture places strong importance on history, traditions, and family values, which are actively preserved and respected in the present. In India, people often prioritize spending time with family and friends or performing traditional rituals over adhering strictly to a schedule. Events like religious ceremonies, weddings, or family gatherings may last much longer than planned because the emphasis is on shared experiences and connection rather than on ending promptly. Interestingly, Indian languages often lack a direct equivalent for the word late, as it's understood on Western cultures. Delays are seen as normal occurrence, and waiting is generally viewed as part of life rather than as an inconvenience. In transcultural nursing, understanding India's concept of time is crucial to providing culturally sensitive care. Nurses working with Indian patients should recognize that a relaxed approach to time may influence how patients view appointment schedules, medical regimens, or follow-up consultations. Patients may not feel the same urgency to adhere to strict schedules, so healthcare providers can emphasize the importance of timely care while showing patience and respect for cultural values. Recognizing this cultural perspective allows nurses to build stronger patient relationships, creating a welcoming environment and bridge potential misunderstandings about time-related expectations.
So in Italy, Italians are known for their exquisite craftsmanship and artistic history. They stick to their past achievements and obtain new ones, relying on the knowledge of their ancestors. So the way Italians integrate the knowledge and craftsmanship of their ancestors into contemporary life
can be compared to the principles of transcultural nursing, which also values the blending of tradition and modernity to create better outcomes in healthcare. So in Italy, craftsmanship is seen as an art form passed down through generations, where respect for the past doesn't stifle innovation but rather enriches and informs it. Similarly, in transcultural nursing, healthcare providers are encouraged to learn from and respect the cultural practices, rituals, and health beliefs that patients bring with them from their communities. Just as Italian artisans build upon the techniques of their forebears while incorporating new tools or technologies to improve their work, transcultural nursing asks healthcare providers to honor traditional healing practices and cultural health beliefs, integrating these elements with modern medical knowledge to create holistic, patient-centered care. So for example, some cultural groups naa sila'y specific mga health practices bitaw nga rooted gikan sa ilang ancestral knowledge like herbal remedies or spiritual healing. So in transcultural nursing, ang mga nurses kay wala ni nila gina-dismiss ng mga practices bitaw, but instead tagaan nila importansya bitaw, like ginasabot nila kung unsay significance, kung mas asa ni siya appropriate bitaw ng mga practices, and also gina-incorporate din nila ni into treatment plan alongside medical care. So this integration allows for more effective care by respecting the patient's identity and cultural context, which can improve the patient's comfort, trust, and sa ilang overall health outcomes.
For present-oriented cultures include the majority of Latin Americans and African countries. For them, what happened in the past should stay there. And what's more, they lay back about the future events and they give little attention to such events since they consider them uncertain and unknown. Therefore, these cultures rely on the immediate results and tend to have detailed plans for the future. Latin American and African people usually pay more attention to their current health issues instead of thinking about long-term health plans. For example, a nurse meets a patient who is not interested in talking about how to prevent future health problems and instead wants to focus on dealing with their current symptoms. In order for the nurse to communicate well, the nurse initiates in asking open-ended questions such as, what are your biggest health concern right now, or unsa man kaayo ang imong concern about sa mga gibati sa pagkakaron. In this way, the nurse can encourage the patient a discussion about their immediate worries, and by this, the nurse shows understanding of the patient's immediate needs, and it is ideal ang pagplano for future health needs, education, and management sa kondisyon sa pasyente. Sa anipod nga pamaagi, by addressing the patient's current needs, slowly na day nato ma-introduce ang idea for planning of future health or flexible nursing care plans that are necessarily aligned with the client's immediate needs, considering the cultural sensitivity and also ensuring that care is relevant and respectful for the patient cultural context. And eventually, makabuild na dayon ang patient of trust sa mga nurses. In the concept of time, there is no right or wrong time use. Every time standpoint is unique to a particular culture and has pros and cons. The world has become a huge melting pot, and the beauty of each culture lies in its unique tradition and values. Applying transcultural nursing requires us to understand how time is used differently in every culture in order to perform effectively in specific circumstances. The process of learning about cross-cultural differences takes time. Nevertheless, the business advantages, lifelong memories, and lasting friendships makes the effort worthwhile. Overall, this effort helps create a kinder and more effective approach to care in a multicultural society.